Hi, everyone. Thank you for joining us. Today, we're going to talk about the Inflation Reduction Act. Is it impacting the lives of many seniors, or is this really good for only a subset of the population? I'm Oded Eran, co-founder and CEO of Connie Health. With me is David Luna, co-founder and president of Connie Health. At Connie Health, we help older Americans save money and get better care. How are you, David?
Hey, Oded.
You've been doing this for dozens of years. You've been helping beneficiaries understand their Medicare. What do you think are like maybe the top two, three parts of the Inflation Reduction Act that impact Medicare beneficiaries?
Yes, thank you. And hello, everybody. Thank you for joining us. Look, 2023 is going to bring about some changes. Right now, what they're looking at is they're looking at drug manufacturers paying rebates, limits to cost sharing on insulins, and then also eliminating the cost sharing for adult vaccines. Those are going to be the top three things that are going to affect people that are eligible for Medicare and that are currently on Medicare. But
Interesting. So let's break it down. A high cost of insulin is something we hear from consumers all the time, and that was a hot topic in Washington. This is really a great step forward by the government. David, would love for you to talk a bit. What's the impact on beneficiaries, and then we've also seen a lot of Medicare Advantage plans already cap cost of insulin at $35. So it would be great if you maybe talk a bit about what's the difference in what the government is proposing to what some companies already do today.
so insulins, in all my years, I think that's always been the number one, complaint is I cannot afford my insulins. And so, and it's not, typically you see people, like, oh, I just take one insulin. Well, but you also have people that take three or four different medications. And then, recently, the pens came out and so forth. So those are more expensive. New medications are being developed. Those are even more expensive. So this new legislation is going to limit the cost of those medications to $35 a month. Now, let me be clear. You may be on a Medicare Advantage plan that you are currently paying $35 a month for your insulin. However, those Medicare Advantage plans were limited to a subset of insulins, meaning they weren't covering everything across the gamut. This legislation is going to cover insulins in general for $35 a month, and it also includes things like durable medical equipment. So some of you may use the units that are either in your midsection or on your arm that you're able to monitor your insulin levels by the use of your phone. So those were never covered, and now for $35 a month you can actually have those.
So this is big news for people with diabetes and people taking insulin. Um, what about the drug manufacturer rebates you mentioned? How's that going to work, and how much money is that going to be?
So that piece of legislation, in a nutshell, says if prices for drugs are increasing faster than the inflation, then Medicare beneficiaries will receive rebates from the drug manufacturers. Now, honestly, let me be real honest here. I don't know how that's going to work. I don't know if there's a check that's going to be mailed to the beneficiary, or if it's going to end up somehow back in their social security checks. I do not know that. I do know that these rebates are going to prevent these high cost medications to at least remain level with inflation,
Yeah,
right?
we've all seen these charts of healthcare costs rising much faster than
Yes.
inflation. I think this is a good way to curb it. I'll be honest, I always believe that pharma will find a way to game the system and call it a new type of drug, so it's not subject to that. Um, that said, okay, so we talked about the insulin that's relevant for diabetics. Um, this rebate sounds to me like it's only relevant to beneficiaries who take brand name medication that is expensive and that has like rapidly rising costs. I don't think this is relevant to generic medicine, who's we know is really cheap anyway, which is
Mhm.
what most Americans take. One of the things that you said you were really excited about the vaccine coverage under the IRA, that admittedly, and I've been in the industry for quite a while, that caught even me a bit by surprise. Do you want to tell our viewers why that's such a big deal?
In this case, we're talking about, let's say, for example, a shingles vaccine. Shingles vaccines in general were not covered, right, through Medicare. And so now Medicare is going to eliminate that cost for these shingle shots. And of course, other vaccines as well. And so I think, again, the focus here with the three things that we're discussing is how do we keep people healthy at a lower cost? How do we say you actually have access to medications that you need, and medications that are going to prevent any type of future type of conditions. So I really like the fact that the federal government is starting to get involved and saying we need to give people access to their medication. Again, not everybody's fortunate enough to be able to afford these things, and so we're moving in the right direction when it comes to helping customers access the care that they need.
That is indeed great news. Um, so those are again in top three. We talked about insulin. We talked about drug manufacturer rebates for high cost drugs that are spiraling out of control. We talked about vaccines. Those are all great, but between us, and really important to tell the listeners, the viewers, that these cost reductions are relevant for probably a small subset of the population. So if you are not a diabetic, if you're not taking brand name medication, and you're not in need of these vaccines, because again, we're not talking about flu shots, we're not talking about COVID shots. Those were covered by Medicare and at no cost. You're not like the not the dog on the Inflation Reduction Act. You, as a Medicare beneficiary, are not benefiting from these measures.
Yeah, I think in general, Oded, the prescription drug plans out there, the Medicare Advantage plans out there that include drug coverage, they're put together so well, right? That um, the medications really don't come into play until exactly what you said. You're either taking insulins, um, you know, whatever way you administer it. Now everybody is really trying to administer their insulin through a pen injection, or they have the unit that I mentioned earlier that goes on your arm or on your midsection. Those can become expensive, but then you've got the expensive brand name drugs, and those are the only people that are going to be affected, right? And I
So
think,
that you actually make a really good point. So we, at Connie, we talk a lot to customers and put them on $0 Medicare Advantage HMO plans. And those plans, if you're not taking any brand name medication, those those plans will limit your out-of-pocket expenses dramatically. Typically,
Mhm.
and always when we talk to customers, like, when are you going to incur really high costs if you're prescribed an expensive brand name medication, or you have some sort of critical illness, and the critical illness is typically capped through your maximum out of pocket. Where you'll really start paying thousands and thousands of dollars is if you are on one of these drugs. So I think you make a good point. What the government is doing, well, a lot of people will actually not benefit. It's the people who need it the most will actually really benefit from this. So that is a really good point, David. David, thank you so much. If you like this episode, please like and share Connie Health and this video. And we're Connie Health. We help older Americans save money and get better care by helping them access the best insurance plans, the right doctors, and we do it always through local advisors that can meet you at the comfort of your home and over the phone, and then can help you navigate your healthcare journey. Thank you so much. See you next time.
Thank you.